Hello, friends. I'm Dr. Puja Kapoor, consultant pediatric neurologist, director and co founder, Continua Kids. So, welcome to you all for the session. And today, the topic of discussion is uh, last time what we discussed was what is ADHD, and today we are going to talk about how to manage attention deficit hyperactivity disorder. So, the topic for today is the management of ADHD. So, a brief about whatever we discussed in our last session was what ADHD is, how to diagnose ADHD, and what we have to do to manage that. We are going to discuss over here. So, the first point is last time also what I told was to understand your child. The most important thing is because in ADHD, because the child has got normal intelligence, the child does beautifully well in the activities, whatever he or she likes, but just cannot perform whatever he or she does not like. So, poor scholastic performance. That means parents will come ki, in spite of knowing the subject very well, in spite of knowing all the things, all the knowledge, whatever is required, he has, but he still is not able to reproduce that in the examination, and because of that, he scores very less marks. So that is why they present as poor scholastic performance or do very, very badly in their exams. They are unable to complete their homeworks, they are unable to complete their classworks, they don't know how to make friends because they are very hyper and they are at times very inattentive. They don't want to listen to others, they want to just talk about whatever they want, and because of that they are unable to make relationships, and later on they land up into a lot of anxiety issues or depression issues when they grow up. So that was a small insight. Now, talking about what to do with our children who have been diagnosed. So, a lot of parents talk about diet. So, let us start with diet. So, it is very well established that, in fact, the European guidelines also puts a lot of pressure, emphasize on that children may get hyper when they consume a lot of preservative, coloring agent fruits or of sugar-rich fruits food. So we should avoid all the foods which have got high amount of sugar, or they have got coloring agents, colored food items, or basically you've got preservatives. So make sure that you have very simple food. It should not be like tasteless food, but simple, homemade, not preserved food, not the tinned food, not the canned food, nothing of that sort. Simple food which is fresh and not uh, a lot older or stale, or obviously not on very high content in sugars. So, in fact, all the homemade food also. So, if you are making halwas or sweets, so make sure that you just reduce the amount of sugar which you are putting in the food. Now, the next is we have another category what we called as behavioral things. So we have to manage the behavior of our child as hyperactivity by behavioral techniques. So for that what we have to do is there are certain do's and certain don'ts which we have to do for our child. So suppose you are making your child sit for his studies. So make sure that his room does not have a lot of distractions. That means there should not be an open window in front of him. So make sure that his face is towards a wall, and also that wall is not very decked up with cartoon pictures, because then his concentration, he would be distracted towards that cartoon. So that would be a very nice non-distractible place where you have making him to read or write or study. Now, Second is to maintain a daily schedule. A timetable is must for these children. So you sit with your child and tell him, okay, so we will get up at 8 o'clock. From 8 to 8:10, we will do the brushing. From 8:10 to 8:20, we will go for the big job. From 8:20 to 8:30, we will do washing or we will take a bath. So, small targets, and a timetable has to be made. And always make sure that you are sitting with your child while making this timetable and make him realize, okay, this is the time which I am allotting. And also make sure that you give 2 minutes for the reminders. So, suppose that from 8 to 8:10 is your time for brushing. So at 8:05, you have to tell him, okay, please do the brushing. Please carry on your brushing. At 8:07, again, you have to come back and tell him, okay, is your brushing done? So now a bit of reminders is very, very important in the child, because at times he may just forget about whatever he is doing, or he will just do brushing, maybe from 8 o'clock to 8:30 is still brushing, and he hasn't still brushed his teeth. So make sure small reminders are there. Make sure that you make a timetable from the time he has to get up till the time he goes to sleep. So if he goes to sleep by 9 o'clock, he gets up at 8 o'clock. From 8 o'clock in the morning till 9 o'clock at night, his schedule has to be there. And that has to be there, and put it on his wall in the room, so that he could also see and make sure, okay, this is the time what we have to do. And he has this realization into his brain. Okay. Now, again, the next was reminders. The third thing is that keep very limiting choices. Suppose you are asking him what subject you want to read. You want to read Hindi, English, science, maths. Don't give him a lot of choices, because he would be confused. I'll read Hindi. No. I'll read Hindi. I will read English. I'll read maths. And he'll just waste on a lot of time. So make sure that you make a lot of choices for him. And then after segregating, if he is good in Hindi and he is very bad in maths, so you find out, I'll pay like an hour today for maths, because he is not good in maths. So don't give him choices. Just make sure that if he is weak in maths, I'll do maths for today for him. Because if you're going to give him choices, he'll be confused himself. Similarly, this is for the school, for the subject choices. You also have to give him limited choices for the toys, for the food, for the clothing, because the more the choices, the more disturbed he would be. So if you want him to take him at today's Sunday, and I'm going to take you where you want to go. You want to go to a park, or you want to go to a mall. Don't give him 3, 4, 5, 6 option. Make him to choose between those two. Okay. Similarly for his clothes, similarly for his toys. Okay. The next is, make sure to make very small and reachable goals in his curriculum. So, suppose you say that today we will do, from in maths, we will do question number 1 to 5 in next an hour. So this is a very small goal. If this is the first time we are going to do this maths exercise, and this is the first time you're introducing this, and he is weak in maths, so 5 question an hour. So you just cannot make that in this 1 hour we will complete 2 chapters. No. So small goals, and with that time limit installed, the child will know the importance of time, and that he has to finish this job into this much of time. So that will really make him concentrate for a while and do this. Always set a clock in front of him, so that he could appreciate the time, with how much time has passed and how much has he done. So if you'll make larger goals, that by this week we are going to do the whole course of maths, no, this he cannot manage that. neither you, neither he, because then that is like for a whole week he doesn't know how to make, how much to achieve in one day. So that small goals you have to make for him, so that he knows the importance of time and he knows how much has to be done in that time. Now, after he has done that work, after an hour, if he has finished that five questions, always make sure to appreciate it with a positive behavior. So, maybe anything. So, you can say that if you will do these five questions in 1 hour, I will give you a star. Get a sticker book. I'll give you two stickers. And suppose make a chart that on Monday you got 1 star, on Tuesday you got 2 star for XYZ activities, for completion of these two activities. On Wednesday again you got 2 stars. Then if you for whole week, if I get 5 7 stars, I'll take you to I'll take you for a ride, or I will let you eat your favorite ice cream, even though this is sweet, this has got preservative, but still once in a while, for a weekly goal, you can give a positive token economy. So that really pushes the child to achieve that goal. So, daily goals, and then on, if you achieve that daily goals, then on that, we have got a weekly goal or a mid-weekly goal, twice weekly, bi-weekly goal. So that really keeps your child to have that attention going, to have that, to keep his hyperactivity in limit. Similarly, don't give punishment if the goal is not completed. Because he's not, again, I'll come back to the same thing, that he's not doing it intentionally. If it has been done by him, he's unable to complete in that stipulated time that type of work which he has been given. If he's unable to do that, that does not call in for a punishment. Okay, so make sure you don't punish the child, else he will, because he doesn't realizes that he has done a great blunder and he doesn't know what to do. He is totally unaware of why he is doing it like this. Okay, so be with your child. So negative, so slapping, hitting, all those negative behaviors are not to be done with the child. Okay, the next is always find some activity in which he is successful, always, because we know that we are working for his loopholes where he's weak. But then we also have to find out something in which he's successful, so that we would be able to appreciate him, and he also have that self esteem. Yes, I can do it. Because what we see is a lot of our children, they just give up, because everywhere they are asked ki, you cannot do that, from the teachers, from the friends, from the parents, from the relatives. You get that negative feedback. तुमसे नहीं हो पाएगा. You won't be able to do it. It's impossible for you to do it. You always do it wrong. So that negative thing just gets into the child's mind, and he just loses the esteem. So in spite of his having good qualities, he won't be able to nurture that, and that also go haywire. So make sure that you always have some hobbies or some of his sport in which he is successful, to keep his self esteem alive, to keep him bubbly, to keep him active, to keep him alert, to give him that self confidence. Okay, that is very important. If he is good at drawing, make sure that he draw. If he is good at skating, make sure that he skates. If he is good at anything, whatever you feel like is hobby or any sport, make sure that he does that and appreciate that, and he'll feel good about it. Now, suppose he's unable to do some activity, or he created a lot of ruckus in front of anybody, somebody who's outside, and you feel like, okay, what has he done? He has thrown a tantrum, he's shown some hyperactivity, or pushed somebody out of somewhere on the street. Please don't overreact at that point of time, because your overreaction is just open up a vicious cycle. He again will overreact, you again will more overreact, and then this would be a never ending thing. And maybe you would just slap him or do something disastrous for the child, for which his memory would always be bad for you. So make sure if your child is having a tantrum or is showing a lot of behavior in front of anybody, just be calm at that point of time. Because a lot of parents ask what to do, just calm down. And if you believe that the situation is really getting out of control, just pull the child from that condition, from that situation, from that circumstances, but don't lose your temper. Because the moment you will lose your temper, just imagine who's there for your child, you know. So you have to be calm. So once if he loses temper, you have to be doubly calm to handle that situation. And once he's out of that situation, that is the time that you can tell him, okay, because you did that sort of behavior which was not justified in that situation, you will be given time out. I'm not going to Today I'm not going to sleep with you, or I'm not going to kiss you, I'm not going to love you for maybe another 1 hour, and I will not make anything special dish for you for 2 days because you did that. So they understand, they are very emotional, so they will understand, okay, my mother did not make good food for me or whatever I like for today because I did this type of things, this type of behavior was shown. So he has this inbuilt thing, and slowly he will realize it, and the next time he won't do it. But you have to make sure that once it is decided that you will not make that special delicacy for him for next 2 days, whatever he likes, please don't make it. Because if he knows that, okay, mama only tells but doesn't do, don't don't just degrade your words only. Just abide by your words, whatever you have said, but make sure whatever you say have to be doubly thought of. So don't overreact at the time of the tantrum. After it has been done, once you are in a very at your home and the child is there with you, just make try to understand him that situation. And because you did that, I'm not going to do this for next 2 days. Okay, that really 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 helps the child. Now, so these are, small tidbits which really helps the child, which helps the child to make sure that he become attentive, and then also he has less of hyperactivity at times. The next thing is, if you have tried up everything but still your child has a lot of hyperactivity, a lot of inattention, now what has to be done? You have tried the food, you have tried all these small things which I have told you, but still the child is not showing any improvement. Please go to your doctor and ask for medication. So there are medication which are there which helps the child in really really concentrating, and also decreases the inattention. Don't be shy about that, there would be so many side effects, what to do. Make sure that you ask for help, because once your child has ADHD, he does not know how to react. He may land up into conduct disorder. There are a lot of other comorbidities which are there, and because of that, he won't be able to do justice with the situations in which he is put to, and that would later cause a lot of concerns. So he may land up into a lot of anxiety issues, he may have a lot of depression later on, he may land up into a lot of conduct disorder. That means he will just not want to obey any of your command, he'll just go opposite to wherever the society is going, or whatever the norms or rules of the society is, because he will feel, I'll just break these rules because this society did not help me a lot, so I'm not going to abide and go by the rules of this society. They'll start stealing, they will start lying to the parents, lying to the teachers, lying to everybody. So, excuse me. So, before your child lands up into all this mess, don't be afraid to go and ask for help for the medication. So, if you look at the life cycle of, or how the cycle proceeds with once a child is diagnosed with ADHD. So as your age progresses, the symptomatology goes down. You haven't seen a adult who is running around and moving all over, who is just jumping around. So all this impulsivity, hyperactivity component, as you proceed with your age, as you grow older, these go down and down. So 65% of the children lose half of their symptomatology by the time they're from childhood, they go to adolescence or adulthood. So, a lot of these go with age. So, that is a good point. If the child has got a lot of inattentive issue, that is something which does not go so much with age, but impulsivity and hyperactivity definitely goes down as you grow up. This is the normal trend which you could also observe. As you were a child, you were very, I mean, you were moving around, but now as you grow up, you feel like you want to sit at some place, you don't want to move around a lot. And as you grow older, you just want to be at a place. So because of this, that's a positive thing which I'm talking about. But for that time period when my child really needs the support, I think you should support your child even if with the medication. A lot of parents tell कि फिर कितने दिन तक, for how long I have to give the medication. So you know the life cycle, you know if how the child will react later on. So you can see that as the age will go, these symptoms will go off. So for a limited period, we really have to try this medication. And at times, we also give vacation off or a holiday weekend off for these medications. Suppose my child who's really not doing well because of his hyperactivity, so we'll give it only during the school days. So on Saturday and Sunday, the child doesn't is at his grandparents place, or is at a picnic, or is on a vacation. So at that point of time, you want the child, he doesn't have to concentrate, he doesn't have to study. Even if he is a bit hyper, even he is showing a bit impulsivity, that's okay. That's what you called as vacation holiday or like weekend holiday. So at times we don't give these medication for during the summer vacations, summer breaks, or winter breaks, because I don't need much output from the child in the form of academics, and he could just run around if he's there in a house or on a vacation. So that much of gap is there, that much of provision we can give for your child. So only those period of time whenever we want our child to concentrate for weekdays, we will give the medication. And a lot of parents ask about what will happen, what are the side effects. In the long run, if you will see the side effects, there are two type of medications. One is like stimulant and other is non-stimulant. And in stimulant, the commonest is methyl phenidate, and in non-stimulant, atomoxetine is what these are the salt name. I don't want to land up into a lot of medical jargon, but believe me, if you compare the effect and the side effect, the effects are much more in a child as compared to the side effects. So what we do is like, if the side effect is the most common is loss of appetite, and that's why what we say is like, after having a good heavy breakfast, you can give your child that medication, send him to school. He may not be able to eat that lunch time, he may not be that much hungry previously, which he was, because the effect of the medication would be there. But as soon as the effect of the medication would start weaning, that means by the evening time, he would again get back to his appetite, and he would be having a good wholesome dinner meal. So make sure, don't make a lot of delicacies in the afternoon or the lunchtime, and make sure that you have the full course meal during that dinner time, because dinner time his appetite would be again as normal as a child who's not on medication, and he would eat everything. So in the long run, there would not be any weight loss, because he would be just missing that afternoon lunch time. And apart from that, his weight, his height, his everything would be normal on the long run. Okay. So there would be small appetite loss in the afternoon, because a lot of the mothers are worried about what is going to happen. No, this is the state of affairs. It's not that they are in the long run they would be behind, or they would be short stature, or they would be losing in the weight. No, it is not there. So make sure that whatever you want to make it in a dinner time, because dinner time is the time when his appetite would be full on open. Okay. So a few of them get a few of them get like gastrointestinal stress. They will have a bit of the nauseating feeling, but with time it just goes off. So for few days it lasts, and rest it just goes off on his own. So I don't want to get into a lot of other side effects, because those are very infrequent one. These are the frequent one which we get and which we have discussed on. And I think this is all how you're going to manage your child if a child has been diagnosed with ADHD. The take home message would be, do all the behavioral thing, do a bit of the concentration exercises, make sure on the diet part, and make sure that he goes for his hobbies, specifically sports. Because if you will expedite a lot of energy, so he will be physically drained out, and that is the time you could help the child to do the task whatever you want to do it. So what I tell my children is, before going to school, just make him run all around, so that his physical energy just channelizes. He's a bit exhaustive on the physical aspect of it, so he would be able to concentrate in the school in a better way. Similarly, if you want him to do his homework, just make sure that he runs over the staircase, expedite his energy, or go and take a round running around and then sit down for his studies. Because the principle remains the same, that we would be able to channelize his energy. So if you are making him see a lot of screen time and he's not moving around, this behavioral therapies and this medicine is not going to help you a lot. You have to first channelize his energy. So there are a lot of famous personalities who suffered from ADHD, but they are like all over the world. So if you have heard of Michael Phelps, so basically he's a swimmer who's the decorated swimmer, maximum number of Olympic gold he has scored, and he has been diagnosed with ADHD. His mother recognized this and put him to swimming at a very tender age in his like nursery sessions, and then he just she just channelized the energy, and there we are with the highest Olympic medal tally which ever anybody human can have. So, you have to channelize this energy. If you channelize this energy in a better way, definitely, these are going to give you better results. Vis a vis, if you just let the child do a lot of screen time, giving food, his habits are not controlled, he's not having any physical activity. Obviously, medicine again would not be helping him in a great way, or his medication would be required in a very high doses. Okay, so this ADHD is basically an amalgamation of everything, whatever I have told. So please understand your child first, and then do whatever is possible for your child, because you are the only people whom he trusts, whose future depends on your thought process. Okay, so we'll go to the sessions, questions. Uh, Hi, Prapti. Thanks for sharing valuable input. Yeah, thank you. Thank you so much, Prapti. It's so nice that you spared your time. Hopefully, everything is good at your end. So, hi, Dr. Monica. My daughter mild autism with ADHD diagnosed हुई है. Occupational therapist से assessment कराया है, तो कहा है कि थेरेपी की रिक्वायरमेंट नहीं है, ओनली स्पीच थेरेपी के लिए कहा. मेडिसिन, राइटिंग स्किल्स, कंसंट्रेशन इंप्रूव हुआ है, हैंड फ्लैपिंग भी कम हुई है. क्या अनदर एक्यूपेशनल थेरेपिस्ट से कंसर्न करें? So the thing is like, a lot of our ADHD children, they have a lot of sensory concerns too. And also occupational therapy helps you in channelizing the energy. So what you can do with sports is same with occupational therapy too. So, but with Dr. Monica's child, occupational therapist has said that there's no requirement as such for. So obviously there may not be a lot of sensory concerns there. Because of that, the therapist must have told you. So I don't think so that you should go in for another. If one therapist has said it, if assessment has been properly done and has been told that you don't require, your child does not have any sensory concerns. So I think you should go either for some sports activity and obviously special education and speech therapy. Okay, but sports I believe is like must for our children for ADHD and autism, because you know the expenditure of energy is very much required in the right way. And if you sit on that extra energy, obviously your child is going to bubble all around. And if your child bubbles all around, obviously his efficiency in the work is going to be hampered. Okay, so Komal, how to stop self talking in ASD. And I want to know that GDD and ASD is different or same. So, ASD and GDD is definitely different. And I have a video, Komal. So, kindly refer to that where I've told you about what is global developmental delay and what is ASD, and also the difference between the two. So, it's a big, long video. You can see and understand. Again, if you have any concerns, I would definitely answer you. So, going to Subaika Khan. Hello, doctor. My child is 20-month old and he's been diagnosed with ADHD. What should I do? To diagnose a child at 20 months, that's not even 2 years of age, with ADHD, I think we generally cannot diagnose ADHD at such an early age. If you go by the DSM criteria, 1.5 years. So it's like not even your child is 2 years. So I believe that don't go for the diagnosis right now. He may be having some symptomatology, which may be red flags for ADHD. So, as I said, please try to channelize the energies. Channelization of energy is very much important, because if you are not going to channelize, he'll be there and always in ADHD. So, for channelization, make sure that you go in for with your occupational therapist, find out other sensory concerns are there or not. Your therapist is going to help you to chalk down a plan where you would be able to do that activities which will just channelize the energy. Put the child in some sort of sports. So basically sports kya, just running activities, cycling, making him to stairs, move up and down. Also, make sure his diet is not a lot of preservative food or sugars. Make sure that he gets homemade food only with less of sugars and no preservatives. And because at this age, there is no medication, there is no diagnosis actually at this age. So make sure that you help your child with all these things. Okay. So, hi Amit. So Amit Singh has asked, my son is diagnosed with mild to moderate autism is and therapy is continued from last 2 months. His eye contact became good. Name response is also good, but he is not following command. So yes, I can understand that it's only 2 months. So if eye contact has come in, name response has come in, just continue. So that means you are on a right track, because first of all, what happens in autism, the connectivity is not there. So if the connectivity, the first thing is like he should be aware of his environment. If he's aware of his environment, he's now connecting. If he is responding to his name, that means he really wants to socialize. He will follow the command. Okay, it's only 2 months. Have patience, have consistency. Definitely you are moving in a right direction. Please do whatever you are doing, you are moving in a right direction. Okay. So, Farman, Kulsuma Parvez is watching. Thank you for sparing a lot of time for listening to us. Thank you so much, Farman and Kulsuma. Uh, Smita, good evening, doctor. My son is 2.5 years. Any small suggestion how to motivate him to speak? Now he started seeing. Okay, so I think what his diagnosis is, it must be ASD, because now he started seeing. So that means eye contact must have come in. I hope I'm reading it right. So if eye contact have started, so make sure the next would be just make use of this eye contact. this is a stepwise approach. You just cannot let him feed him with words and make him speak. So don't hold his face and make him to speak. Jao, because he has started seeing at you, so that means he would be wanting to know what your ways of talking are. And now the time is to fill him with a lot of receptive words. You know, take object in front of him and tell him ball, apple, because right now he's seeing towards you. So this is how a normal child learns. How does a normal child learn? A normal child, you just don't wake him, make him to speak ta va pa. No, you just make him to look at an object and tell him, okay, ball, cat, apple. And because your first step has been beautifully crossed, because he's been now been interested in you and he's looking towards you. Now that is the time to full the child, bombard the child with a lot of receptive speech. Put him with a lot of speech, receptive one, so that whenever he gets in a lot of vocabulary, definitely he's going to speak. Okay. So, Amit, what we can do that he follow our command, what he has required, he pick his hand and request to us. We are very worried this will follow command in future or not. So, Amit, only 2 months have passed, and if like eye contact has come in, name response has come in, definitely the command following will come in. So, right now, make sure that you play with him, and during playing, when he's attentive towards you, start giving small commands. So, suppose you have put up a puzzle. Okay, so puzzle mein, yeah, there are two words जो है you have to join. So you tell him, okay, let's join, and help and show him how to join. So, you're speaking those words because there he's there with you. If he's good with the eye contact, he's listening. He's seeing whatever you are telling. If he's respond to his name, that means he's listening whatever you are telling. So again, what I told to Smita was, give him a lot of receptive things. Always talk with him with not like big sentences. अरे तुम यहाँ आओ and ये करो. No, 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 no. Make sure that you do small, a verb and a noun. A verb and a noun. ये दे दो. Book रख दो. Book ले लो. Pencil दे दो. I'm using a noun and a verb. I'm using a noun and a verb. So like two words, and if you feel like, you can just start with noun only. So first, noun, object identification. Apple, ball, cat, mat, papa, mummy, nak, aank. These are all noun. So you can start with that, and then you can go with the second joining with the verb. And this is how it proceeds. Don't panic. Don't worry. Your child is doing well. In 2 months, he's done beautifully well. So he would do well. So, Subaika Khan, doctor, just a second. He never listen when we call him by his name, but we always listen rhymes, TV. He never do eye contact. So that means Subaika, as I guess. So he's not ADHD. This is autism. So I think you have written down, because I just gave you the options for ADHD, and that's why I was surprised that who has diagnosed you with ADHD at 20 months. So the symptoms which you are telling is, it's nothing to do with ADHD. He doesn't listen to your name. He is not giving eye contact, but he always listen to rhymes and music. So this is not ADHD. This is autism. Kindly have a view at my video where I describe what is ADHD and what the difference between ADHD and ASD. Okay, so Subeka, so please, this is not ADHD. That's why I was surprised that who has diagnosed you at 20 months with ADHD. Okay. सो इंडियन यूट्यूबर सोनी, मैम मुझे 3 दिन पहले ही पता चला है कि मेरे बच्चे को ऑटिज्म हैश एडीएचडी और कुछ ब्रेन डिजीज है. मेरे बेटे की एज 3.5 है. ओके, सो you have to get him diagnosed, because I don't know, कुछ ब्रेन डिजीज है, ऑटिज्म है, एडीएचडी है. फर्स्ट मेक श्योर व्हाट इज द डायग्नोसिस, बिकॉज देन ओनली यू वुड बी एबल टू वर्क ऑन इट. Okay. So, hi. So, Chudi Samrat. मैम, मेरा 4 साल का बेटा ऑटिस्टिक है, टिपटो होकर खड़ा होता है, बेड पकड़कर। क्या टैक्टाइल फिनोमेना की वजह से टिपटो करता है? क्या वॉकर देना कुछ हेल्प करेगा? ओटी करा रहा हूँ, सेंचुरी। So, but because I could see that 4 years, but he is able to stand only with holding the bed. So, a child who has got sensory phenomena, I don't think so. This is just sensory. Is he able to walk? Is he able to run? Is he able to climb stairs? Because if he is not doing that, I think this is not just sensory. This could be a motor phenomena also. So, I need a full history on this. Okay. Uh, अब्दुल मैम, मेरा बेटा 2.2 में 3 मंथ से थेरेपी लेकर जा रहा है, बट ही इज कंटिन्यूअसली क्राइंग, ही ऑलवेज वांट्स मी, ही इज डायग्नोस्ड एज ऑटिज्म। ओके, सो 3 मंथ्स हो चुके हैं। सो अगर 3 मंथ्स के बाद भी अगर बच्चा रो रहा है, इज ही लर्निंग समथिंग और नॉट? Is he doing something or not? And if you feel like that after 3 months also my child is continuously crying, I think you should change the plan. Okay, because if he's not learning and he's only crying, because there are two options: if he's just crying and not learning, then I think you should change the plan. But if he's crying a bit but he's also learning a bit, I think you should continue and you sit there, because he always wants me. You can sit at there with the therapist so that he gives you a soothing thing and he can do work. But if he's not doing learning anything, if he's not doing anything, he's continuously crying, I think you should change the plan a bit. You should change the therapy a bit. Okay. Okay. Uh, Smita, thank you so much. Very useful. Thank you, Smita. I hope I would be able to help you in any ways. So, ma'am, sometimes my son follows command incorrectly, but not always. That means if I ask him to point, he touches his head. Okay, so he's a bit confused, Abhi. So just pay more attention, because at times, we see that maybe once we are giving the command, he may be understanding, but he's not attentive. So he knows that my mother always tells me to do this, this, or this. So without listening to also your command, he may be inattentive and he may be doing it like this. So maybe that could be inattention, or maybe that could be he's not processing the command very well. So keep on trying on that. If he started doing, at least I know that we are in a right direction. Okay. So hi Pooja, ma'am, is there any medicine for autism? And I think she wants to say autistic child. So autistic child, the core symptoms, you don't have any medicine, but definitely if the child is associated with sensory concerns, if the child has sleep concerns, if the child has GI gastrointestinal concerns, if the child is has having excessive crying, or if the child has associated with any seizure, for all those are medication, but not for the core symptoms. So if my child is not speaking, I give him medication, and the child starts speaking, no. So there's no medication for that. Okay. Uh, Shireen, how to reduce hyperactiveness in the child? I think I've talked a lot. You have to view this video once more. So, how to reduce the hyperactiveness? I've given you certain tips, and also about the food, about the sports, about the OT, and last but not the least, about the medication. I think that should really help. Subaika Khan, thank you so much. You help us. I'm from Pakistan. I really appreciate your work. Thank you so much, Subaika. Hope that helps each and every child whosoever requires it. And I think we have done up with the questions. So thank you, everyone. A very good night, and hopefully you help your children in each and every way, whatever is required, because you are the only whole soul support system of your children. Nobody else in the world would think as much for your child as you, being as parents. Please do well for your child, support your children, help your child, and do well. A very good night. Take care, all of you.